Hey guys, so today's video is going to be just basically explaining everything that's going on with me right now, and it's very emotional for me still because it's only like a couple of days since I got my diagnosis, so I'm like still really scared and emotional. So I'm gonna try not to cry, and I'm just gonna try to talk about what's going on with me. It's so crazy how your life can change in just a few days. Like, everything is different now. So I've been feeling weak and tired, and I've had headaches every day for the past month, you know, but I've struggled with illnesses in the past. I've had Lyme's disease. According to the blood work that I had done, I've also had mono in the past, which I was completely unaware of, but I guess it went away. And I also had parvovirus. So I've had a lot of illnesses that I sometimes was unaware of, and for the past, you know, 4 or 5 years I've always been tired and just not feeling very well. But this past month some really alarming things started to happen that started to scare me. But I'm the type of person that always likes to just remove those thoughts from my head. Like, okay, it's fine, it's just a B12 deficiency, it's an iron deficiency, it's fine, maybe I'm just slightly anemic. I was getting bruises all over my body. I was feeling, Frankie, what are you doing, buddy? I was constantly feeling tired, and I had a shortness of breath, which I just kind of attributed to maybe anxiety. I don't know, I felt like something was not right with my body when I was in Europe on vacation, but these bruises just kept showing up on my body. And I remember I climbed a mountain which is like almost 5,000 feet tall, and I remember the entire way up my legs felt like cement blocks. Had people twice my age passing me like it's nothing, and I was struggling so hard and so out of breath. And I know I may not look sick to you guys, and like a lot of people might be like in disbelief that this is happening, and trust me, I am too. I don't understand like why this is happening to me. I don't feel like I deserve this. So I made an appointment to go to the doctor, and on the day of my appointment I was so tired that I almost didn't go. But that was like my weakest day, and I gathered up all of my strength that day to go to the doctor, and thank God I did, because if I hadn't gone to the doctor that day, I might not be here right now. So I had blood work done because they suspected it was maybe a B12 or an iron or a folate deficiency. Maybe I was just like slightly anemic. Maybe my Lyme's disease had come back. There were just a bunch of speculations. So they did the blood work, and then the rest of the day I just went about my day and just relaxed. And the following morning at 8 a.m. I got an urgent phone call, and the nurse or the physician said that my platelets were at an 8, when that means 8,000, and they should be between 140,000 and 400,000. So they were critically low, and platelets are basically cells in your body that help your blood coagulate and prevent internal bleeding. So if you don't have enough of those, you can have spontaneous internal bleeding at basically any moment, which explains why I had so many bruises all over my body. My white blood cell count was down, which is what helps you fight infections, and my red blood cell count, which is my hemoglobin, was also critically low, which means that I was not getting enough oxygen to my brain and my major organs, which would explain the lightheadedness and why I felt so tired. So like basically I guess I was on the brink of death. And so I called up Brad, and he left work and he brought me to the emergency room where they admitted me, and they once again repeated the blood work and immediately admitted me into the hospital, gave me a room. And the doctors were really concerned. They said that this is like really dangerous, that this is very severe, and that they needed to like give me an emergency blood transfusion, and the first thing that they needed to do was give me platelets, which they gave me that day. And they didn't know what was wrong. They didn't have any answers. Leukemia, like just all those words like were just coming up because that's like what's typically seen. as they did more tests, they ruled out a lot of things. I have no deficiencies, like B12, folate, iron, all that were excellent. They said that, you know, my diet is great and that my health, in my general health, is fine, which is why I've been able to go so long with this without, you know, like completely giving out. And like they checked me, you know, they checked a lot of things, and after 4 days of being in the hospital and getting blood transfusions and getting a bone marrow biopsy done, which by the way was like so horribly painful, one of like the most painful things ever. I'm so blessed and lucky to have had Brad there, and my mom was there too. Like they were both there the entire time pretty much. And while I was getting my bone marrow done, like I was like holding on to Brad and like basically screaming because it was so painful. And I didn't know when I was going home. And after they started to look at the bone marrow sample that they took, they were like telling me that cancer is like at the bottom of the list, because they didn't see any cancerous cells or any kind of signs pointing to cancer. So thank God. But on the 4th day, well actually even before the 4th day, the doctor kept asking me if I have siblings, and I like didn't really know why he cared so much whether I have siblings or not, but now I know why. Because on the 4th day he told me that it's pretty certain that I have aplastic anemia, which is a severe bone marrow disorder, and basically my bone marrow is failing. And so I will probably need a bone marrow transplant, but because I don't have a full sibling, I have a half sibling, it's gonna be a lot harder to find a full match. So Monday I go to my oncologist, hematologist person, and we're gonna start looking into bone marrow transplant. And if we don't immediately find a match, I will have to go through some sort of treatments, which I guess are similar to chemotherapy, because they're supposed to suppress my immune system, because apparently, I don't know, my immune system is attacking my bone marrow because my bone marrow isn't producing enough red or white cells or platelets. So yeah, like I'm basically bubble girl for the next, I don't know how long. My doctor said this is long term. This is probably something that I'll have to live with for the rest of my life until I find a bone marrow donor. And it's really scary because my life has changed completely over the course of 4 days. I'm just glad that I went on that vacation, because I'm not going to be able to travel for a while or do anything really. I'm going to have people help me every day. And yesterday I went for a walk with Brad and Frank, and it was like the most amazing thing, and it made me really like be appreciative of the small things in life, like being outside, like nature. I've been watching a lot of videos and I've been doing a lot of research, and there's actually a couple like YouTubers that I found on here that also have this disease, and this is day 2, day 3, so I'm like a mess right now, and I'm scared. Like I don't want to die, you know, like I have so many plans for the future. There's so many things I still want to do, and so like I keep freaking out, you know, like I'll go through waves where like I'm okay for a little bit and I'm calm, and it's like I've eradicated that thought of being sick and like potentially dying, but like then it comes back and it hits me over again, and I just freak out and I panic. So I just need to get to that point right now where I'm like ready to fight this and like not gonna give up, and I'm like nothing's gonna happen. I'm not going anywhere. Like I'm staying right here. I want to keep busy. I don't want to like drown in my own sorrows, so like I'll be keeping you guys updated on my day-to-day life and like how it's going. I think the one positive I can find is that this has made me realize like who cares about me in my life. It's making me appreciate my friends and my family. It's bringing me closer to them because I see how much they care for me and how much they're concerned. And also I think that it's good that I have this platform and that I can now like raise awareness for this disease. And not just this disease is also like linked to leukemia and MDS, which is like pre-leukemia, so like I can talk about that on here and, you know, maybe do something more than just talk about my experience, but also help other people that are going through something similar. So yeah, so hopefully my next video that I make about this, I'm in better spirits and I'm feeling better, because right now I'm still a fucking mess. But yeah, so I'm going to leave a couple links down below if you guys want to know more about this disease or hear other people's stories, and then also go check out bethematch.com, and I believe there's some other donor sites where you can join the registry to be a bone marrow donor. All it takes is, like, I guess, to answer a few questions and to go to a clinic and get a swab taken. So I really encourage you guys to go do that, because not only can it save my life, but it could also save somebody else's life potentially, and that's like amazing. So many people have already messaged me telling me that they're going to do it, or people that said that they've already done it, and like that's amazing. Like that's like the most wonderful gift you can give to somebody. So thank you so much for all the support and love, everybody, and I will hopefully be in better spirits next video.